In the past year, the world is still suffering from a global pandemic called COVID-19. The World Health Organization has estimated over 126 million confirmed cases, including over 2.7 million deaths. In the United States, as of April 2021, over 31 million confirmed cases, over 566,000 deaths, and over 23 million Americans have recovered. But still in the United States, we still have 7 million active cases. We know that this virus does not discriminate. In the United States, communities of color have disproportionately accounted for almost 30% of deaths in some states. The African American community has already suffered the brunt of health disparities, inequities, and racism. Recently, the director of the Centers for Disease and Prevention, Dr. Rochelle Walensky, issued a dire warning. Due to increasing coronavirus cases, we are seeing increased hospitalizations, which are filling up the emergency room and ICU with young people. So why should we be concerned? Because it is a threat to our healthcare system. Let's discuss it. The global impact of COVID-19. Welcome to Nurse Informed. Hello, my name is Michelle George, and welcome to this segment of Nurse Informed. We're going to talk about the impact of COVID-19, a global pandemic. What is SARS? SARS belongs to the coronavirus family. This is a group of viruses that affects the respiratory tract, and it's a lot of infections in a variety of animals and humans. COVID-19. We remember on January the 20th, 2020, the United States had the first case of COVID-19. The World Health Organization gave the coronavirus its official name, abbreviated as the CO standing for corona, which is a crown-like appearance, VI standing for virus, and D for disease, known as coronavirus 2019. What are zoonotic infections, which researchers believe this is the origin of coronavirus? A zoonosis infection is transmitted from animals to humans and also can transmit from humans to animals. Researchers have long known that the coronavirus origin is in a pangolin and a bat. Coronaviruses are in a large family of viruses that usually cause mild respiratory illnesses. There were 3 new coronaviruses that have emerged from the animal reservoir to the human population in the last 20 years, which included SARS, the severe acute respiratory syndrome, MERS, the Middle Eastern respiratory syndrome, and now we're looking at COVID-19. If you're looking at the screen right here, how are zoonotic diseases transmitted? They're airborne, and they can transmit from animal to human. And once it gets from human to human, we run a risk of having an epidemic and a pandemic. As discussed before, the Middle Eastern respiratory syndrome, this was a viral respiratory infection. It was also known as camel flu that they thought may have come from the civet cat, the bat to the civet cat. It was a viral respiratory infection that was caused by the Middle East syndrome related to coronaviruses. And this was in the year 2012. So when we look at COVID-19, we know it's a respiratory illness. Now, what are some of the signs and symptoms? I know in the early part of the epidemic, people were experiencing fever, cough, chills, fatigue, and body aches. But as COVID-19 started to mutate and emerge more into going from human to human, more symptoms started showing up. Fever, chills, shortness of breath, headaches, a loss of taste. A lot of people was experiencing a loss of taste or smell. And the researchers were finding out that when that virus was exposed to the nasal passages, it caused a type of inflammation where people started noticing their first symptoms that they could not taste or smell food. Research has long pointed to the inequitable conditions from the past to the present. Many people of color we know as African Americans or the Hispanic population experiencing housing inequities, healthcare, and educational inequities. According to the CDC, non-Hispanic, American Indian, Alaskan Indian, or American African Americans have suffered the brunt of hospitalizations. Racism also played a role in this pandemic because we remember where we saw a physician that died in the state of Illinois where they would not offer her certain medications to treat COVID-19. In the city of Chicago, African Americans made up of 68% of deaths in Chicago. When we talk about, we know as an African American community, since we stepped on the shores, we continue to experience the racism and the inequities, but we keep going. Through the years, we've known what we have experienced, but we continue to keep going in this fight.
If you had a hard time, let me see, just wave your hand from side to side. Fellas, I want you to come on in softly. Through the years, I had a hard time. Through the years, I had a hard time. Through the years, I had a hard time. I had a hard time. Listen. Into each line, some rain must fall. Rain must fall. But God, He promised to see us through it all, and all through the years, I had a hard time. When I look back over my life, through the years, I can say I had a hard time. Through the years, I had a hard time. Through the years, I had a hard time. I had a hard time in my life. Yes, I have. Yes, I have. Yes, I have. Hard. Oh, yes, I did. In my life. When I look back over my life, see all the things that happened for me. Kept the loving arms around me. Yes, He did. In my life. Oh, 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 hard time, hard time in my life.
What is the role of vitamin D in COVID-19? Vitamin D is just not a vitamin for bone and calcium, for calcium health. Vitamin D is also a cellular hormone. Vitamin D is known to have anti-inflammatory effects on our immune system. It also increased the effectiveness of our white blood cells. Are we getting enough vitamin D? Well, we know studies have found in many parts of the country, this deficiency is more pronounced in people in northern latitudes and also in darker skinned persons. 82% of African Americans suffer from low vitamin D. And research has shown that it also could have contributed to the deaths of persons having low vitamin D levels. Here we see another study that looked at 216 people with COVID-19 and found that 80% of people did not have adequate levels of vitamin D in their blood. The Journal of Clinical Endocrinology and Metabolism researchers have found, did the study in the country of Spain, that persons who had low vitamin D levels and was on a ventilator, they had significant poor outcomes with trying to recover for COVID-19. New research shows that high vitamin D levels may protect against COVID-19, especially for African Americans. So remember, do not just go out and take vitamin D. What I would like for you to do is see your healthcare provider and know your vitamin D levels. There is also a study that is out, obesity and the risk of COVID-19 infection. The coronavirus disease pandemic has resulted in worldwide research. A growing number of reports have connected obesity to more severe outcomes of COVID-19, which led to poor outcomes. We now know that obesity is linked to impaired immune function. Obesity decreases lung capacity and reserve ventilation that can be difficult. So if you are exposed to the virus, it would be harder for you to rid the virus. And also there was a study done on COVID-19 cases that suggests an increase in hospitalizations and intensive care among persons that were obese. But there are also new studies were coming out for persons who were underweight, also had suffered from COVID-19. And they also looked at the a BMI over 30, which correlates your weight to your height. Pre-existing condition risk for COVID-19. Having any of the following heart conditions, coronary artery disease, high blood pressure, congestive heart failure, also having stroke increase a person's risk of COVID-19. There were also other conditions as kidney disease, persons that were suffering from immunosuppressive viruses like multiple sclerosis and lupus. Now, what to do if you're diagnosed with COVID-19? Now, you see here where it says trouble breathing. If you're having trouble breathing, sometimes that can be too late. So make sure if you're having problems with a confusion, you're feeling pressure in the chest, there's some discoloration, call 911 and make sure you get to your emergency department right away. But also in a lot of the stores, you may see pulse oximeters. In the early stages, I've seen on TV. I did see on TV where emergency room doctors were talking about having a pulse oximeter handy, which can detect the oxygen level in your blood. What are some of the complications of COVID-19, known as long haulers, known as post-COVID syndrome? Well, a lot of people who were diagnosed with COVID-19, sometimes the virus still tend to lie in the tissues, the body tissues. People were suffering from inflamed heart, kidney injuries, increase in depression, anxiety, and mental health changes. So where are we now with COVID-19 in this pandemic? We have vaccines to prevent COVID-19. And right now we have 2 mRNA vaccines known as Pfizer and Moderna. The emergency use authorization, which is an authorization used to facilitate the medical countermeasures of vaccinations when you're in a pandemic. We know how does mRNA vaccines work? Well, it takes genetic instructions that is given to the immune system for the spike in the spike protein. We've seen plenty of pictures of the spike protein of COVID-19. The researchers have known to take a piece of that spike protein, put it in a substance that is easier to transfer to our cells, and we have an immune response and antibodies where our immune system would notice that spike protein to produce antibodies to protect us against COVID-19. So recently, the Center for Disease Control just put out a research where fully vaccinated people may travel. Right now, there's an estimated of 100 million Americans who have had at least 1 dose of coronavirus vaccine, and also 51 million Americans have already been fully vaccinated. The long-awaited guidance from the Centers for Disease Control and Prevention is welcome with this new news. So as we continue to follow the measures of preventing this virus, we will get to the end of this pandemic. What is herd immunity? Herd immunity means that enough people in a community are protected from getting a disease because they already have had the disease or they've been vaccinated. So what did I just recently stated? At least 100 million Americans have already been vaccinated with one vaccine, and 51 million Americans have been fully vaccinated. This is how you get to herd immunity. If most people get vaccinated, then the virus is contained, as well as hand hygiene, social distancing, and wearing a mask over your nose and your mouth. So what are the best ways that we can prevent COVID-19 to try to lessen our risk and strengthen our immune system? Make sure we're cutting down on sugar. That research is out there that high sugar can affect our white blood cells known as neutrophils. Make sure you're eating fruits and vegetables, relieving stress, and we know that's sometimes hard, and we also see what's happening in the African American community dealing with COVID-19 as well as the virus of racism, as well as Asian Americans. You want to make sure you get enough sleep, because when you sleep, you tend to rest that immune system. And also remember to practice hand hygiene, which is hand washing, and try to increase your exercise. But if you're unable to exercise due to certain barriers, you can also, if you're sitting in a chair, you can move your limbs, you can move your feet, and you can also take deep breaths several times a day. When we look at the researchers involved during this pandemic, Dr. Anthony Fauci, who has been involved from the research of HIV to Ebola and now with COVID-19, we see his team, one of his team members being Dr. Kizzmekia Corbett. Dr. Corbett is an African-American woman who has been praised as the key scientist behind the COVID-19 vaccination. She has also recently talked to President Biden, and as we remember, President Biden discussed wearing a mask for 100 days, because if you wear that mask, believe me, you reduce your risk and it gets us one step toward ending that pandemic. So what can we do to stop the spread of COVID-19? Keep that social distancing. It matters. Making sure you cover your nose and mouth when you sneeze, wearing a mask in public, making sure your mouth and nose is covered, cleaning and disinfecting surfaces, washing your hands, and staying home when you are sick, because we've seen the impact of this virus even on children. The United States is showing that we've lost over 100 children, including adolescents, to this virus. How to wear a mask, face mask correctly. Right here, a lot of times when I'm out in public, we see people wearing a mask above their nose. And as you see, the virus can get right in your nose. You want to make sure that mask is covering your nose and your mouth. So let's review again. What are some of the preventive measures? Washing your hands, wearing a mask, staying 6 feet apart, avoiding crowds, and getting that vaccine for those who can take it. We know there will be a small fraction of people who will not be able to take this vaccine. Persons who are allergic to the components of the vaccine, persons who have a low platelet count known as thrombocytopenia, but make sure if there's any vaccine hesitancy, make sure you speak with your physician. If you notice your blood pressure is really high on the day you take your vaccine, like 150 over 100, you may want to delay getting your vaccination. The reason because hypertension can cause what you call a cellular debris that can interfere with your immune function, and we need your immune system to function after you get your vaccine, as well as if you're suffering from diabetes or living with diabetes, making sure you keep those blood sugars under control. So when you get vaccinated, your immune system will be able to work at making antibodies. After vaccination, make sure you download, it's called V-Safe. I know I received my vaccine yesterday, my second vaccine of Moderna. And what you do, you sign up for this tool, and the CDC just wants to track your the side effects of this vaccination. So as I end this portion of Nurse Inform, I just want you to stay encouraged as we get near the end, as we're trying to get near the end of this pandemic. I want to thank Wayne Todd and the Men Who Will for singing Through the Years. I also want to thank Mr. George Dean and the Gospel 4 for singing We Still Need You, a gospel song, asking the Lord that we need him each and every day. Thank you for sharing your gifts and your talents. I spoke to both of those artists recently, and thank you for contributing to this project of Nurse Inform.
It's just like you said, people would turn to the wrong in our darkest hour. Don't leave us alone. Oh, we still somebody talking about wars going on everywhere. That ought to let you know that we still need you. Wait a minute, wait a minute. We still need you. 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 How many of you have had people to talk about you? You done them nothing but good. We still need you. And look like every time you try to do